Welcome everyone to tonight's forum from the League of Women Voters, Columbia, Boone County. Tonight we are focusing on the human impact of Medicaid expansion. And I am Barbara Hoppy. I will be your moderator, the moderator for tonight. I'm on the League of Women Voters board. And this program will be recorded and available at the League of Women Voters Columbia Boone County Facebook and website. So you can watch it or share it with your friends in the future. I want to say thank you to Sharon Schneeberger, who is our Zoom expert from the League. And I want to remind everyone that Medicaid expansion is on the ballot August 4th. And we look forward tonight to getting some really good information. Mari Scala will introduce our speakers. First one speaker and then another speaker. Mari is on the League of Women Voters board. She chairs the Health and Mental Health Committee for the League of Women Voters, Columbia, Boone County, and she also serves on the Board of Health of Boone County and the City Board of Health Commission. So with that, Mari will introduce our first speaker, and then we'll have, we also have a chat feature. So if you have questions, go ahead and write the questions down. If our speakers can take them while they're presenting, they may do that. Otherwise, we'll try to get to them at the end of each speaker's segment. And with that, Mari Scala.
Thank you, Barbara. We have two speakers tonight, Dr. Heidi Miller and Jack Cardetti. And Dr. Miller is going to be going first, so I'll read her bio first. I also wanted to mention that this is being recorded and will be available on both our website and our Facebook page, so you can share that link when it comes out and encourage your friends to tune in as well. Dr. Heidi Miller is a primary care physician and patient advocate who's focused her career on assuring high quality, trauma-informed, integrated, equitable healthcare for our most vulnerable patients. She trained at Yale University and Harvard Medical School and completed her residency in internal medicine at Harvard's Brigham and Women's Hospital. She served as a primary care doctor at Family Care Health Centers, a federally qualified health center in St. Louis, for 17 years. She is also the medical director for Gateway to Better Health, which serves 20,000 uninsured patients via the St. Louis Regional Health Commission. Dr. Miller consults for the St. Louis Integrated Health Network, Missouri Primary Care Association, Patient-Centered Health Home Initiative, and Siteman's Breast Cancer Partnership. She was appointed by the Missouri governor to the State Oversight Committee for Medicaid, served on the Missouri Medical Home Collaborative Steering Committee, and she's testified to both the Missouri House and Senate committees on health policies. She was recognized by St. Louis Business Journal as one of its 40 under 40 honorees. And in 2019-20, with enormous collaboration across multiple organizations, she was the citizen filer of the ballot petition for Medicaid expansion in Missouri. I would add that she also, as one of her other qualifications, is the daughter of a League of Women Voters member. So, Dr. Miller, I'll hand it over to you.
Thank you so much. Can you hear me okay? Thank you for that nice introduction. And yes, indeed, I grew up in Rochester, New York, and my mother was an avid League of Women Voters member, and I learned very early from her the lessons of your organization. So thank you for this opportunity. I would just echo that we'd like this to be a dialogue, and so please enter your questions into the chat as we go along. I also want to tell you that I really enjoyed the first installment of this Medicaid expansion series. I watched your video on YouTube for the Medicaid Expansion Forum on July 8th. It was a debate format, and I really appreciated opposing views, and so thank you. This will build on that further. So here are a few essential points that I hope that you'll be able to glean from the next 15 minutes from my presentation. I want to focus on who gets Medicaid in Missouri now. So we're all talking about Medicaid expansion, but expanding from where? Like, why is this a thing? I'm going to focus on the status quo so you understand the compelling need for this initiative. Then we'll talk exactly what Amendment 2 does. And then I just want to take a moment to debunk myths about Medicaid. And then finally, there's a few hidden gems to the current Medicaid program that are unknown and I'm happy to share. So few more details. So Medicaid in Missouri is called MoHealthNet. So they are synonymous in our state. I have taken care of Medicaid patients for 17 years, and I have really struggled to take care of patients who don't have insurance. Over the last 17 years, approximately a third to half of my patients have had no insurance. And so we start off now with the status quo. Like if we're voting on Medicaid expansion, then what is Medicaid now? Like, how do you qualify for Medicaid in Missouri? Well, it depends who you are. In fact, in Missouri, you can only get Medicaid if you fit a few categories. So you might be able to get Medicaid if you're a child, if you're pregnant, if you're blind, if you're disabled or 65 or above, or if you're a parent or a guardian. So these are the only categories that may be eligible for Medicaid currently. So who's missing? Adults. So what's missing is my patients who work, they work minimum wage job, they either have no health insurance from their employer or they can't afford health insurance from their employer. They're trying to take care of their needs and they have no health insurance. So childless adults, but look who else is missing. So in this disabled category, that's a very technical designation by the SSI department, Social Security Department. And what is missing here is sick adults. And those are the patients that I see. Adults that don't fit into these categories, but are actually ill, where they have congestive heart failure and they're trying to ask me to write a note to their daycare employer that they're allowed to wear their oxygen while they're at work. This is the type of patient that I will take care of who has no health insurance. I have a patient who is a waiter and has no health insurance, but he has one joint that has severe arthritis right at the base of his thumb. It's a very common site of osteoarthritis, but his thumb kills him. Now, that one thumb is necessary to carry a tray of 30 pounds to deliver plates to to his customers. And without having that one thumb fixed from the damage that has been done, he can't do his job. But if he had health insurance, he could see a hand surgeon, have his surgery, and get back to work. Unfortunately, that patient of mine who was a professional waiter, he could see me at a federally qualified health center, but I am not a hand surgeon. So without that opportunity, I watched what I hate in my practice. I watched that disorder deteriorate to the point of disability. And sure enough, he filled out his disability paperwork within a few years, and then he qualified for Medicaid. So our current system actually almost incentivizes people to have their disease progress to the point of disability in order for them to have the health insurance. And by the way, you do that hand surgery 7 years later instead of originally, and you don't retain the same function. So this is the status quo. But that's not enough. It's just these categories, but isn't it about income, right? Medicaid is for patients who are under the federal poverty level, right? So 100% of the federal poverty level for a single person is $12,000 per year. And so traditionally, Medicaid was designed for patients of low income. So you think, okay, well, we have these categories, then I guess you have to meet this category and that you also have an income requirement that you be under the federal poverty level. But welcome to Missouri. Every category has a different criteria. So FPL stands for federal poverty level. So children in a family who are under 300% of the federal poverty level will have access to Medicaid. And then it goes down and down and down and down. And the saddest, even if you're in one of these categories for the parents, you have to earn, if you're a single parent, you have to earn less than $3,000 in order to have Medicaid. Now, I presented this to the medical students at WashU, and they said, who decided this? They're used to seeing things that are evidence-based and medically logical. And the answer is that politicians have designed this, that someone else decided the different value of different categories of human beings. This is the approximate dollar amount for each of these categories. And as you can see, it's most generous for children, and then it differs throughout each of these categories. Now, this is the status quo. This is why we're here. Amendment 2 would expand Medicaid to raise everyone up to the 138% of the federal poverty level. And in addition, most importantly, it would see that new yellow arrow on the right, it would include adults that happen not to fit into those categories. This is Amendment 2. So if you choose to vote yes on Amendment 2, you're essentially saying, okay, we're gonna help our patients that are barely making a little bit above the federal poverty level to actually be eligible for Medicaid, and to include adults, not just limiting to these categories. So let's just look at the status quo again. I just want to look at some reasons why this is so compelling. Missourians care very much about children. So this shows, like, yes, let's insure children up to 305% of the federal poverty level. But if we really care this much about children, then they ought to have parents who are healthy and are not diabetic and not paying for their insulin and letting their sugar rise in order to pay for the field trip and to pay for the dinner on the table. And this is obvious to you, and it is obvious to everyone, but there is plenty of medical data and studies that support that the health of children is directly dependent upon the health insurance status of the parents. So we have the medical data to prove that parents who are insured and healthy, their children have better health outcomes, lower weights, lower asthma exacerbations. Now, another feature of our current system of the status quo. So pregnant women were up to 201% of the federal poverty level. But in 2016, the Missouri legislature passed the Show Me Healthy Babies bill, which expanded coverage to low-income pregnant women and their unborn children. So essentially that raised pregnant women up to 305% federal poverty level in caring for that mother and the fetus inside of her. So look what happens to that mother after she delivers. She loses her Medicaid 60 days postpartum, and then she tries to go back to work. But at this point, if she earns more than $3,000 per year, she's going to lose her health insurance. So if we're truly trying to incentivize people to work and to be healthy while working, the status quo is actually providing sort of a perverse incentive. So essentially, she would be going from a salary of $36,000 as a single person, and if she were a single parent, it would be down to $3,000. So back to Amendment 2. So Amendment 2 provides Medicaid expansion from this archaic patchwork of our status quo of Medicaid coverage. A few points about this. Remember that currently, adults who don't fit into those categories, if they're under the federal poverty level, they get no Medicaid. But you say, well, we got the marketplace, right? The Affordable Care Act provided the marketplace and subsidies, but the subsidies don't start until someone's at 100% or above. So that's the gap. It's a very cruel gap. Now you say, well, what if someone gets really sick? And in fact, I had a patient early in my career who had lung cancer. And this patient was 49 years old. She worked at a very popular historic diner in the Central West End, smoky diner, taking care of patrons for many, many years, and she developed lung cancer. I was new to Missouri at the time, and I knew that she had no health insurance. I knew I was a good doctor, but I cannot treat lung cancer. And I was like, well, there must be some way to get her coverage. I mean, she has lung cancer after all. And the answer is no. So just having lung cancer was not enough. And actually, there's only one circumstance where you can get Medicaid if you're sick. And that is if you have breast or cervical cancer. So there is a small program in Missouri. It's funded by the CDC. It's called the Show Me Healthy Women program. Every state has this program. It's called the Breast and Cervical Cancer Prevention and Treatment Program. This program is the result of very successful lobbying for women's health. And it basically stated that if a woman in Missouri doesn't have health insurance and she develops breast cancer or cervical cancer and she can't afford insurance, that will be a ticket to Medicaid. Beautiful. I know many patients who benefited from this. However, I learned in med school in my anatomy class that women have colons, livers, brains, kidneys, and developing cancer in any other organ does not allow for a ticket to Medicaid. So this is the illogical status quo of our current system. And to the point that that patient with lung cancer also had to progress to the point of disability in order to get her ticket to health insurance. So who gets Medicaid in Missouri now is so limited. And in fact, Missouri is one of the stingiest states in the country that restricts eligibility for Medicaid. Now, if this ballot passes for Amendment 2, Medicaid expansion would allow those patients from the age of 19 to 65 to go up to 138% of the federal poverty level, showing you, as I showed you in the diagram previously. So, next part of my presentation is debunking a few Medicaid myths. So one question is, can't you just get Medicaid if you choose not to work? And the answer is no. So in our state, strict income eligibility only applies if you're a child, parent, guardian, blind, disabled, or over 65. So it leaves out our patients who are working with unaffordable health insurance. Another comment is just, shouldn't they just get a job? I mean, just take responsibility for your own health care. More than 75% of the Medicaid expansion enrollees in Missouri work or are full-time caregivers, and they are barely getting by. Do you know the minimum wage in Missouri right now? It is $9.45. So I have patients who are working multiple jobs, and they are the ones that could potentially benefit. In Ohio, 84% of working enrollees reported it was easier to work and there were fewer missed days of work. And then I have an equity challenge for you. We talk about like these Medicaid enrollees, you should just get a job. Well, first of all, most of them are already working. Secondly, do you know the most popular point of the Affordable Care Act? It was that you could keep your children on your health insurance until the age of 26. Is anyone asking those kids of rich, wealthy parents who are insured to work? No, those kids are going off to, I don't know, Europe or college or taking the summer off and not needing to worry about health insurance. This really is a true equity issue. Third myth to debunk is, isn't Medicaid just a dysfunctional program? Well, this is outdated information. Are we conflating a dysfunctional, overpriced, fragmented healthcare system with a safety net provider? I am the first to criticize our entire healthcare delivery system. There are so many improvements that we can make, but when we think about taking care of this vulnerable population, we can't blame them for the problems of our healthcare system and deprive them of healthcare and to keep them out. The cost per enrollee for Medicaid is actually lower than for employer-sponsored insurance, and there's a robust health outcome and preventive care data that shows that it's that they are optimized with insured status. And then I just want to briefly talk about something that the Medicaid program has done since 2014. The Patient-Centered Health Home Program is actually a shining star cost-saving program for our sickest Medicaid patients. You have heard that in a population of patients, there is usually a minority of very sick patients that cause the highest level of cost. And Medicaid actually has implemented the Patient-Centered Health Home to address some of the sickest patients. The current Medicaid is not your mother's Medicaid program. Things have changed over the years, and Medicaid expansion is associated with quality, patients are very favorable. They favor the health insurance. And then this patient-centered health home program, I just want to let you know, this is sort of a gem in the system currently. There's 37,000 enrollees, and they are the sickest enrollees of Medicaid. So these are patients who might frequently go to the emergency room or the hospital, which for the record is at least $3,000 per night. Most of these patients were enrolled with chronic illnesses, and the patient-centered health home program created by Medicaid provides these patients with nurse care managers, continuity, a behavioral health consultant, and someone who is analyzing their data to prove that we are actually improving their quality. Currently, there's 172 sites across Missouri of federally qualified health centers, hospital-affiliated organizations that are implementing this. And this program provides a per member per month payment to these health centers to take care of the sickest, most vulnerable, most expensive Medicaid patients. And by doing this, they have saved so many hospitalizations and ER visits that there has been $165 savings per member per month. Briefly, this program has reduced blood pressure, it has improved diabetes, it has reduced cholesterol, and the hospitalizations and emergency room visits, which are the biggest costs, have been reduced, leading to this cost savings of $165 per month. With that, I'm going to stop. I just want to share a few pictures of my patients and staff. I've been given explicit permission to share these pictures of our patient-centered medical home. And in summary, current Medicaid eligibility is extremely limited. That's why Medicaid Expansion Amendment 2 is on the ballot for August 4th. We talked about a few myths about Medicaid, and I want to just share some clinical assets of the Medicaid program. With that, I turn it over to you. Thank you. Oh, I think you're muted still, Barbara. Just click on.
Mute there. Thank you very much, Dr. Miller. That was extremely well done and interesting. There is one question so far that we have. It's, can healthcare providers afford to serve patients at Medicaid reimbursement rates?
So that's a valid issue. Is the reimbursement for Medicaid high enough to increase access? And traditionally, the Medicaid reimbursement has been less than that of Medicare and private insurance. So to individual providers, if they are very serious about taking care of Medicaid patients, they can apply to be a part of that patient-centered health home program. If they engage in that program, they will get, it's about $45 to $50 per member per month extra money to actually take this very holistic, comprehensive approach to taking care of those patients. Also, thinking about hospitals and rehab facilities, those facilities are taking care of patients without any insurance, so anything would help for the bottom line.
That answers the question well, and let me just double check to see if there's any more questions, and there's not. If anyone has more questions for Dr. Miller, go ahead and put them on the chat, and then we can take those at the end of the program. And now Mari Scala will introduce our next speaker.
Okay. Thank you very much, Dr. Miller. Our next speaker is Jack Cardetti, and he's a very busy man these days, as is Dr. Miller. He's the president of Tightline Public Affairs, and he has worked in Missouri for nearly 2 decades as a spokesman and strategist for federal and state elected officials, winning political campaigns and successful public affairs campaigns. He served as the official spokesman for 2 Missouri governors and remains an oft-quoted expert in news stories throughout Missouri and among leading national publications. In the 2018 election cycle, Jack served as communications consultant for the defeat of Right to Work, with 67% of Missouri voters opposing Prop A. And in that same cycle, also led the historic effort to approve medical marijuana in Missouri with 66% of the vote. He also helped design and deliver the messaging that in 2018 helped pass the first comprehensive energy bill through the Missouri legislature in more than a decade. He helped Jason Kander become the youngest statewide elected official in America in 2012. Jason was the Missouri Secretary of State. He also led the successful effort that year to prevent changes to the nonpartisan, merit-based Missouri court plan by defeating Amendment 3 with more than 75% of the vote. That was a very decisive outcome, and it was one dear to the hearts of the League of Women Voters because it kept our merit-based system for appointing judges. So his most recent thing that he's working on is he is the spokesperson for the Yes on 2 campaign. And I'll turn it over to you.
I really appreciate everyone's opportunity tonight. I'm going to speak only for a little while because I want to get to make sure that Dr. Miller and I can answer everybody's questions. You know, obviously what Barbara said at the very start is the most important thing, which this election is on August 4th. So this is only 19 days away. That's when Missouri has the opportunity to become the 38th state to expand Medicaid. And so, Dr. Miller, we've heard a lot from her on the health side of this. I'm going to talk a little bit more about the economic side of this because this is absolutely a healthcare issue, but it's certainly an economic issue for our state as well. Now, only a couple weeks ago, the voters of Oklahoma went to the polls and they passed Medicaid expansion. They joined the states of Nebraska, Maine, Utah, as having passed Medicaid expansion by a vote of the people on the ballot. And so that's what our campaign has done here. We are a coalition, and one of the broadest, most diverse coalitions that I've ever seen here in Missouri. We went out, started last fall, collecting signatures, person to person, in every corner of the state. You need 170,000 signatures to place an initiative like this on the Missouri ballot. We ended up getting nearly 350,000 signatures. And so this really is a citizen-based effort because for quite too long, we haven't been getting the results, and Missourians and their healthcare have been left behind. And so voters took this into their own hands, and now we've placed it before the voters on August 4th. And so while Oklahoma passed Medicaid expansion, that's obviously a huge deal for that state. What it means, though, for us as Missourians is that our tax dollars are now going to 37 other states to expand access to health care. And while that's great for people in Oklahoma, and it's great for people in California and Arkansas and New York, here's the problem in Missouri. We're paying for Medicaid expansion already with our federal tax dollars, but we're not getting any of the benefit of it. So what Amendment 2 would do, and this is really, really critical from an economic standpoint, is it would bring $1 billion a year of our own tax dollars back from Washington, D.C., and put them right here in the Missouri economy. Like many people on this call tonight, there's a reason Columbia is such a good place to work, live, and raise a family. And one of the things that makes Columbia special is we have access to healthcare. But quite frankly, we're also not getting our fair share. Can you imagine if that $1 billion a year after Amendment 2 passes is invested back in our local communities? Now, that's the precise reason why, one of the reasons we have such a large, broad, diverse coalition. When it comes to economic issues in the state of Missouri, the Missouri Chamber of Commerce and the Missouri AFL-CIO, organized labor, they don't agree on anything for the most part, but they both agree on Medicaid expansion. And I think that's really telling. So if you look at the coalition that's come together to pass this, it's the Conservative Missouri Chamber of Commerce, it's the Conservative Missouri Catholic Conference, it's organized labor, it's civil rights groups, it's AERP, it's first responders, it's doctors, nurses, patient advocates, and healthcare workers. And they all know that this is, not only is this a huge way to improve the health of our citizens and to decrease the health disparities among our communities, but it's a really, really opportunity to help our local economies at a time, quite frankly, that we need that help more than ever. So Missouri is one of the leaders in the nation in a category that you don't want to lead the nation in. And we've seen this not too far away in Boonville. Since 2014, Missouri has seen 15 hospitals across our state close, including 10 of those hospitals in rural areas. And that's one of the leaders in the entire country. And so in these local communities, not only is the hospital a place where locals can get quick, efficient access to care, in many places, it's also one of the largest employers in that town. And so by passing Amendment 2, one of the real benefits is we're going to be able to protect thousands of frontline healthcare worker jobs. Right now, these healthcare heroes, the essential workers that are putting their health on the line right now, we're asking far too much of them. But one thing we can directly do to help them is to make sure their jobs are still there. Because we know that the number one thing you can do to keep hospitals open in a state is expanding Medicaid. Because right now, it's not that people aren't getting sick. And in fact, people are getting sicker because they don't have access to preventative care. But they're accessing that care at the most expensive place possible, which is the emergency room. And so that's one of the reasons that Amendment 2 actually will save the state money, is because right now we're still paying for people when they get sick, but we're paying for them when they get really sick. We're not providing preventative care like we could. So the other issue you have when your local hospital closes down is you have to go farther and farther out, probably not even in your local community, to access healthcare. Now, if this recent pandemic has taught us anything, it's that local access to care is absolutely important. When a hospital closes down in a rural area in Missouri and someone has to drive an extra 45 minutes to the hospital and they have a stroke, they're having a heart attack, that extra 45-minute drive really could be the difference between life and death. And so these are serious issues, but Missourians have an opportunity to tackle them August 4th. So Heidi kind of talked about the different federal poverty levels. What does that mean in total? Well, in total, it means that if we pass Amendment 2, we can help provide access to 230,000 hardworking Missourians who earn $18,000 a year or less. Now, there's a reason the very conservative Missouri Chamber of Commerce has come out in support of this. That economic activity we talked about, when instead of sending our tax dollars out to Washington and letting them go to 37 other states, bringing that back and investing those in our local communities. When the Missouri Chamber of Commerce endorsed Amendment 2, they did it mostly on that basis. When they endorsed, they sent out and linked to a study done by REMI that actually shows what will be the economics, what's the economic increases that we're likely to see if we pass Amendment 2. And what it showed is that we're likely to create 16,000 more jobs annually if we pass Amendment 2. We're able to see $2.5 billion in increased economic activity. Missouri alone will see $1.6 billion annually in our GDP. So these are all ways that our economy will directly be benefited if we pass Amendment 2 and start investing those federal dollars right back here in our communities. Now, a town like Columbia, obviously, with several large healthcare systems, will be a direct beneficiary of that. Now, a lot of times when we're talking about public policies, some voters say, well, okay, that sounds good, but is it a tested, proven policy or not? I used to work in government for a long time, and that's one of the first things we always ask is, well, are any other states doing it? What's been the impact there? I think there's one really telling thing about Medicaid expansion. 37 states have expanded Medicaid right now. 0 states have reversed course. Not a single state that's expanded it has turned its back on it. It's working in those states, and it can work right here in Missouri. For instance, when Mike Pence was governor of Indiana, he expanded Medicaid in there. This is not a Republican or Democratic issue. It's not a blue state or red state issue. This is about making sure that we are investing our own tax dollars in our local communities keeping our rural hospitals open, making sure that people have access to care in their local communities, and protecting thousands of frontline healthcare working jobs. Now, there's been several other studies that have come out, including last year, Washington University looked at the cost of this, right? Because the federal government picks up 90% of the cost of Medicaid expansion. The state is responsible for 10%. But because of the economies and because of the fact we're treating preventative care healthy people, there are huge opportunities for cost savings in the Missouri in the state budgets. And so there is another report that WashU, when they looked at this, they ran all of the data, they took a look at this, and they, by the year 2024, Medicaid expansion is expected to save the state $924 million that year. And so that's an incredible cost savings. At the same time, we're getting the economic benefit of Medicaid expansion. And so I think that's one of the things that people are so excited about, is that not only will we have better health outcomes and benefits, as Dr. Miller talked about, but the tremendous opportunity we have to help our economies for something that, quite frankly, we've already paid for, but we're not getting any benefit, is really exciting. And I think that's one reason that you see all of these groups coming forward to support Medicaid expansion that don't usually agree on these issues at all. So I'll stop there. That's a little bit about what the economic activity around Medicaid expansion is. And obviously, we'd love to look forward to taking your questions.
Great, thank you so much. Wow. Very powerful economic case stated. We do have quite a few questions that have come in, and what I'll just say the question, and either of you can jump in and answer it, not at the same time, or both, whatever is appropriate. Let's see. How long does the process certifying a patient for Medicaid take? Guess maybe that's for Dr. Miller.
Yeah, it takes 15 days for a pregnant woman and 30 days for others that are for others that are applying.
Thank you. Let's see, the next question. How would Medicaid under the new law affect the financial health of hospitals? Maybe that's,
Jack, you want to take that?
for both of you?
Yeah, it really, study after study shows that that's the number one thing that we can do to help improve the financial health of hospitals and to keep them vibrant, is to pass Medicaid expansion. There was a great op-ed recently that ran here in Missouri and several places, and it was a hospital CEO that both, they have clinics and hospitals on the Missouri side of the state line, and they have hospitals and clinics on the Arkansas side of the state line. They treat very, very similar populations of people. The really only difference between those two, the hospitals within that same system, is that Arkansas has expanded Medicaid. They're getting 90% of that paid for by the federal government, and Missouri hasn't done so. So as a result, they had to shut down their Springfield, Missouri hospital on the Missouri side, while the Springfield hospitals are thriving down there. Now, if that's not a tale of two states, I'm not sure what is. It's a very, very powerful thing. If you care about healthcare jobs, if you care about your local hospitals, the number one thing you can do is bring friends with you to the polls on August 4th and support Medicaid expansion. It makes a lot of fiscal sense from a state budgetary standpoint, from an economic standpoint, and obviously from a healthcare standpoint.
Thank you. Another question. Can you tell us more about PCHH? How does it differ from other primary care? How is it organized, and how does it achieve the cost savings?
You know, traditionally the medical model is a little bit like the deli counter, where the clinic waits for patients to call and ask for help and request appointments. In the same way at a deli counter, they just wait to make sandwiches for whoever comes and asks for a sandwich. It's a reactive form of healthcare delivery. And that may be one of the reasons why it is quite expensive in our country to deliver healthcare with mediocre outcomes. The patient-centered health home model is a proactive model, where instead of just waiting for patients to call, no, who's going to call? It's going to be the healthiest patients that are making sure that they perfectly get their diabetic visits every 3 months. What we really worry about is that population of patients that may not be like calling to ask for help. And so we as a health center, as a patient-centered health home, we proactively take care of patients. So we have a registry where if Medicaid gave us this patient to take care of in this program, we better damn take good care, excuse my language, sorry ladies, but better take good care of that patient. So we now have a patient registry, and instead of waiting for people to call us, we very proactively call them. We have to have a clinical touch with each one of those patients every single month. It might be a visit in the office, it might be a phone call. Those patients have a nurse assigned to them and they get the direct number for their nurse. They have continuity of care with the same provider and that nurse. If we haven't heard from that patient in more than 30 days, the nurse is reaching out to them. If the nurse can't reach them, then we send a community health worker to go to their home and make sure that they're okay. The Patient-Centered Health Home program also affords for behavioral health integration. So we have mental health services that are totally infused in the medical model. So every patient in that program gets to see what we call a behavioral health consultant, who's a social worker and a psychologist. And frankly, treating diabetes, dialing the insulin up and down is easy. It's engaging a patient, having those motivational interviewing and psychological skills to engage a patient, to get a sense of why is it that you're not loving yourself right now enough to really take good care of yourself. Why are you ignoring your congestive heart failure and your diabetes and putting your husband's needs first or your children's needs first? And I have testified that our behavioral health consultant has treated diabetes even better than I can, because she has so powerfully motivated patients to have that self-efficacy to take care of themselves. Those are some of the assets of the program.
Oh, thank you. That was very informative. We have a few more questions. Let me get back to them. In the past, what has been the biggest opposition to expansion in Missouri? If it makes economic sense, why hasn't this been done already?
Yeah, so quite frankly, our politicians are almost always a lagging indicator of what the voters want, right? And so we've waited around for a decade now and watched state after state after state expand Medicaid, get the benefits while we sit here in Missouri and pay for it. And so that's one of the reasons the campaign is doing this through initiative petition. We want to present this voter, or this question directly to the voters. We can't rely on politicians doing it otherwhere. Unfortunately, in politics, the easiest thing to do almost always is nothing. And we've seen what the status quo has done for us here in Missouri. It's led to hospital closures. We have really, really below average health outcomes. Our economy is lagging behind others. There's very rarely is there one policy that can help touch all of those different areas. And quite frankly, it's a proven policy at this point, like I've talked about. There's a reason that we always refer to this as the show me state, right? Is something working somewhere else? We want others to look at that before we are able to invest in it. And I think that's what we've seen here. 37 other states have picked up the ball. They've expanded Medicaid. They're Republican and Democratic states, and they're reaping the benefits of that now. And there's no reason we can't do that here in Missouri. I mean, another interesting report that came out from the Missouri Hospital Association, Missouri Primary Care Association, Missouri Nurses Association earlier this spring actually looked at 3 other Midwest states that aren't unlike Missouri in a lot of ways. So it looked at Indiana, it looked at Arkansas, and it looked at Ohio. Because though there always are concerns. Okay, well, even if the federal government's paying 90% of this, does that mean it's going to hurt Missouri's budget? Will it cost us a bunch of money? And what it found there is when those 3 Midwestern states expanded Medicaid, not only did it not cost the state money, but it actually freed up general revenue dollars to go to things like education, to go to transportation and other public policy programs. And that's exactly what the WashU study says can happen here in Missouri. We can get better health outcomes. We can have a more vibrant, growing economy at the same time that we can help plug some of these budget holes that are obviously the state's going to be facing now. And so I think that's one of the things here is that this didn't happen for a long time because the politicians, it was always easier to do nothing. Now we're going to bring this in front of the voters, and we're so glad that we have so many coalitions supporting this. For instance, the state AARP has endorsed Amendment 2, and you're thinking, well, okay, that's interesting, but aren't a lot of their members on Medicare anyway? So why would expanding Medicaid help in that situation? But what the AARP says is absolutely correct, which is, look, if you have private insurance or you have Medicare, that's great. But if your local hospital or local clinic has closed down because you haven't expanded Medicaid, that Medicare or that coverage you have doesn't do you a lot of good. And that's why day after day after day, we talk about one thing on this campaign, and that's access to care. I mean, Dr. Miller lives it every single day. Her patients are able to get care in their local communities, and that's what this will be able to do for 230,000 more Missourians when we're done.
Thank you. Yes,
Can I
go
add
ahead.
to that? Yeah,
Sure.
I really, Jack's points are very compelling. I would also add, I think there's just a concept of out of sight, out of mind. It's easy to blame and judge people that you can't see and you don't know, but I have a patient who was a wedding photographer, really struggling to hold on to his career, literally to hold on to his camera. He had neuropathy. I was trying to get him to a neurologist to help me with this, but he had no health insurance. And one day, while shooting a wedding, he did a face plant, cracked his camera, and cracked his orbital bone, and came in with a fracture of his face. Like, that's one story. I've got 1,000 others of like. This guy's trying to support his own business. He can't afford his own health insurance. Like, so if you just don't meet someone in that situation, maybe it's not on your awareness. I think also people have the false impression of, oh, well, we already have a safety net program, right? Just go to the ED, or you can go to one of those clinics, like the clinic that I work at. But again, you can't get out of the emergency. My patients bring me their bills. You can't get out of the emergency room for less than $3,000. The cost to see a primary care doctor for a preventive visit costs the system about $100. So we got $100 of preventive primary care versus $3,000 going to the ED for something that I may have been able to take care of myself. Likewise, even though someone might be able to access primary care if they're in a region close to a clinic, again, I'm not a neurologist. I can't take out a gallbladder. I can't do a stress test. I can't do an EEG for a seizure disorder. We don't have a safety network right now, and this is supposed to be part of it.
Thank you for adding that. Okay, I know we still have several questions. Let's see. Do you think the pandemic has helped more people understand the importance of health care coverage for everyone? Whoever would like, Dr. Miller, probably?
Yes, absolutely. People understand how devastating it is to lose their job and lose health insurance, and how incredibly scary that is when they are economically tight and they don't know whether to put food on the table or pay for some kind of health coverage, or even to be able to go to the doctor. Here's the other thing. The federal relief packages that have been released through different waves of legislation have relied heavily on the infrastructure of Medicaid. If the federal government's trying to rescue the country, through its healthcare delivery, how are they going to do it? So they've actually relied very heavily on Medicaid in order to figure out which states, what cities need how much money and how to send that money through.
Thank you. Okay, let me go to another question here. Let's see. Oh, I thought there, let's see, do you have a help? I guess that is the last one I see on the pre-questions. I was wondering myself, I'll ask a question. I had seen who the opponents are, the very small list of opponents to Medicaid expansion, and I was wondering if you might want to comment particularly on my husband received a text message from Americans for Prosperity to oppose the amendment on August 4th. And so can you talk a little bit about who's behind that and why?
Barbara,
Yes.
just one second. Barbara, notice there are 3 questions in the Q&A at the bottom. But go ahead, please, and answer.
Okay.
Yeah, so Americans for Prosperity is one of these sort of dark money federal groups based out in Washington, D.C. And so they did a couple weeks ago have town halls around the state. We went and looked at a few of them. They were such smallly attended that they didn't even end up putting them on their social media pages or Facebook or Twitter. And so there really isn't a ton of organized opposition. So far, the only person to spend money against this is a lobbyist that actually lives in Florida. And so far, that's the only group that has come out and spent money against this. And I think that is one of the things that I think is really compelling about this, is that you have all of these different groups that don't always support and sort of have differences about what the best direction for Missouri to go in. But all of them have come together here and said, look, the number one thing we can do when it comes to the economy, when it comes to healthcare, is expand Medicaid here. Let's get the benefit of those federal dollars. Let's make sure that we're investing in our local communities here. And I think that is really compelling. I mean, there are the Missouri Chamber of Commerce, the Catholic Conference, AARP, Missouri AFL-CIO. These are groups that don't often agree on the issues, but they've all come together for this. And so I think, when you take a look at the 2 sides of each campaign, it's important to notice who's supporting those groups and for why.
Thank you very much. Sharon, I cannot see the Q&As from my view. If you see any questions, or Murray.
I
Okay.
can. I'll jump in here. I think we've answered the first one. Why would anyone or group oppose this? I think we've covered that. The other 2 are similar in nature from 2 different people, and that's about the continuity of the money. If we vote for this based on the 90% federal match for 10% Missouri money, is there an end date for that? Will it stop in the future? How do we address that concern?
No, that's a great question. And that is one that comes up quite a bit on the campaign. No, the 90% federal match is a permanent Medicaid match rate. And so that is not something that will change over time. Now, in fact, had Missouri been an early adopter of Medicaid expansion, we actually would have gotten more than 90% for some period of time. So it's phased down basically from 100% match down to 90. 90 is the lowest it'll go. That's the permanent match rate. And it's important that we plan off of things like that. We get asked all the time, well, what if something happened in Congress and the law got changed or whatever? Every year we look at our transportation budgets, for instance, in the state of Missouri, based on the match rates of the federal government and for MoDOT. And so this is a permanent match rate. We'll always get the 90%. It'll never go below that.
Thank you for clarifying that. We're almost at the end of our time. And that, I think, was the last Q&A, correct, Mari? So thank you so much, Dr. Miller and Jack Cardetti, for the information you've given us on Medicaid expansion. I want to encourage everyone to vote on August 4th. Vote yes on number 2. And I also want to
your friends. Tell
all your friends and share this program with them if they have any questions or need more information. And I also wanted to remind everyone that we have a Lunch and Learn program next week, July 23rd, and that will be with the Republican primary candidates for the Boone County Commission. The Democrat is unopposed. So we will be doing a Q&A forum on that next Tuesday. So thank you so much, both of you, for all your work and sharing all your valuable information with the League and our viewers.
Just to clarify, Barbara, is that on Tuesday or is it on Thursday? I was thinking it was.
It's the 23rd. Oh no, it's Tuesday is the luncheon. Oh no, it's the 23rd. Okay. Yes.
In the evening.
I'm focused on the Lunch and Learns. This is the forum. Thank you, Mari. Yes.
Thursday.
July 23rd at 7 p.m.
Okay. Thank you very, very much.
Thank you.
Thank
We
you so much.
appreciate it. And for
Time to talk with us.
any more information on the campaign, anybody can go to yesonto.org. So everything from how to vote in this election to any facts and figures about the amendment, that's the place that you can find all that information. Thanks so much for having us on tonight. We really appreciate it.
Thank you.
Thank you.